How does radiation therapy affect future lung cancer risk? Have you ever wondered how radiation therapy might impact your future risk of lung cancer? This is an important question, especially for those who have undergone treatment for other cancers. Radiation therapy, particularly when directed at the chest area, can indeed increase the risk of developing lung cancer later in life. This risk stems from the potential damage radiation can inflict on normal lung tissue and DNA, leading to new primary lung cancers years after the initial treatment. Research indicates that patients receiving radiation therapy for cancers near the lungs, like breast cancer or initial lung cancer, are at a higher risk of developing a new primary lung cancer compared to those who did not receive radiation. This increased risk typically becomes noticeable 5 or more years after treatment and continues to rise over time. For instance, women treated with radiation for breast cancer have been found to have about a 1.6 times higher risk of lung cancer compared to those who did not receive radiation. This risk can become even more pronounced 10 to 15 years post-treatment. The techniques used in radiation therapy can also influence the level of risk. Advances such as intensity-modulated radiation therapy and breathing adaptation techniques are designed to reduce the dose of radiation that healthy lung tissue receives. These modern methods help lower the risk of radiation-induced lung cancer by minimizing incidental exposure to the lungs. Another factor to consider is the volume of lung tissue exposed to moderate or high doses of radiation. This is often measured as the percentage of lung receiving 20 Gray or more. The greater the volume of lung exposed, the higher the risk of lung tissue damage and subsequent cancer risk. Techniques that aim to reduce this volume can help decrease long-term lung cancer risk. It's also worth noting that radiation therapy to the chest can lead to other long-term complications, such as radiation pneumonitis, which is inflammation of lung tissue, and cardiotoxicity, which can affect heart health. These issues can further impact overall lung health and survival. Additionally, while not therapeutic, repeated exposure to diagnostic radiation, such as from CT scans, carries a small but measurable risk of inducing lung cancer over a lifetime, especially with frequent scans or high cumulative doses. In summary, radiation therapy to the chest does increase the risk of developing lung cancer in the future due to radiation-induced damage to lung tissue and DNA. This risk is influenced by factors such as the radiation dose, the volume of lung exposed, and the specific techniques used during treatment. Modern radiation methods aim to minimize this risk by sparing healthy lung tissue. If you have undergone thoracic radiation, it is crucial to have ongoing lung health monitoring and to discuss your personalized risk with your healthcare provider. Always remember, consulting with healthcare professionals is essential for understanding your individual situation and ensuring the best possible care for your lung health.